For my project, I'm doing The Devil Wears Prada, and I'm focusing on Emily, who is the senior assistant of Miranda Priestley, who's the editor-in-chief of Runway magazine. And in The Devil Wears Prada, it takes place in the mid-2000s in New York City's fashion industry, which embodies like a sense of being perfect, competition, and being fast. Employees have to work long hours, they face criticism, and they have fear of failure, chronic stress, and are obsessed with detail. For Emily's diagnosis, her symptoms align with a typical anorexia nervosa, because she displays extreme calorie restriction, anxiety about her weight, and loses a lot of weight throughout the movie. She's not visibly underweight, so she doesn't fit all the symptoms of regular anorexia. In the film's culture, it reflects the Western high fashion culture, which glorifies being thin and restrictive eating is expected. And if Emily were to go to a therapist, she would probably be diagnosed with typical anorexia. But it should be noted that her behavior is socially reinforced because she feels like she's pressured to be thin due to her job. And stigma surrounding eating disorders in the USA is appearance-based stigma, gender bias, glorification of dieting, and self-blame. I don't think this disorder is diagnosed in all cultures because different cultures have different ideas on the perfect body, and not all cultures prioritize being thin. And some evidence are some of the symptoms that Emily displays are restriction of energy intake, behaviors preventing weight gain, and a symptom that she doesn't display is body image distortion. She never says that she hates her body. She just values being thin due to her job. And she's driven by workplace demands and just being thin so she can fit into the signs for Paris Fashion Week. And the treatment that I think would work best is CBTE, which stands for Cognitive Behavioral Therapy Enhanced. It's designed to address all forms of eating disorders. It deals with symptoms like over-valuation of thinness, restrictive eating habits, and perfectionism. And in research done, it showed that CBTE improved the symptoms of eating disorders and even led to healthy weight gain. And some ethical concerns might be that there may be a weight bias, and because Emily's not underweight, she might not be taken as serious as other patients. And due to her job, Emily might face many barriers that can prevent her from receiving proper treatment. And broader perspectives are that typical anorexia is not very properly portrayed in The Devil Wears Prada. It's seen as a joke, and Emily jokes about, she doesn't joke about it, but it's taken as a joke that she doesn't eat anything, and if she feels like she's gonna faint, she eats a small cube of cheese. And her disorder is seen as funny, but when it's really something that requires treatment and underplays how serious the disorder can be. And many films can portray stereotypes about people who are affected. It can normalize symptoms by trying to be funny, but they can also increase awareness and empathy for people who are suffering from eating disorders. And that's the end of the presentation, and these are my citations.